This is the Halftime Show with Omar Al Duri on Pulse 95.
Nice strike! Oh, better than nice! Wonderful!
It sure is that time. You know what time it is on a 3 p.m. on Saturday? It's the Halftime Show on Pulse 95. Yeah, I give myself applause sometimes. How are you guys doing? Hope you guys are doing well. Thank you very much for tuning in on the Instagram Live at Omar Al Duri. Fantastic. Some familiar faces from Mustafa to Michelle to Masoud to Shayma to Terry to Ibrahim, to Tintin, to Smooth, to Olivia, to Mohajar, Condado, and the list goes on. Thank you very much for connecting with us. And what a show we have in store today. Miffy is on the show today.
Hello, Omar.
How you doing?
Very well, thank you.
Looking bright today.
Yeah.
Yeah?
I wanted to match.
Well, we're going to need that on the episode today because you're definitely adding some flavor to the show. Now, injuries obviously is, say, your forte. You handle people on a daily basis. You look after people, including myself. Yeah,
indeed.
It can be hard work. But the ACL, firstly, is something that you hear a lot. What is the ACL first?
The ACL is a ligament. It's the anterior cruciate ligament. It's one of the main stabilizers of the knee.
Yeah.
And the anterior part stands for, it attaches onto the front of the shin bone. And then the cruciate part is a Latin word meaning cross. It crosses the posterior cruciate ligament, which is a little less important.
Yeah.
The whole purpose of ligaments is they join bones to bones, and they generally do it in a specific direction. So the ACL's purpose is to stop the shin bone moving forward on the thigh bone. So it's super important in sports like football, handball, netball, when there's a lot of acceleration, deceleration, change of direction, cutting, when the foot's outside the base of support and we're changing direction. And when that happens, the shin bone wants to move in one direction, the thigh bone wants to move in the other direction, and the ACL's job is to keep them together. Unfortunately, sometimes it snaps.
And so if you're, for example, like a runner, is there less chance of you getting that?
Much.
Okay,
much less.
Because of the change of direction.
Exactly, yeah. And because it's the unpredictability. You know, if you're doing a 200-metre sprint, you're still changing direction, but it's very gradual. You know what's coming. You know how to feed forward to your body to say, we're going around the curve, now we're turning into the straight. If you're playing football, you're reading the play as it goes. You must have fast reaction times. And that's where the risk comes in. It's actually not, people often think that it's about contact sports.
Right.
And what we're finding now is that the evidence says majority of the injuries don't happen in contact. They're in contact sports, but they're not actually during contact times.
Interesting. So is there also a trend on the evidence of what sport causes the most ACL injuries?
Oh, it's quite controversial, yeah. It's not controversial, sorry. It's just lots of different opinions.
Yeah.
In my opinion, I think the highest rate is actually handball, which is predominant in kind of Scandinavia. But soccer or football, Aussie rules is really high, netball is really high. Those sort of sudden stop change sports.
I'm kind of interested because I know you deal with athletes from every sport. I've seen them on your page. I've seen you post about them, and they're different body sizes as well, different builds. Do you notice that sometimes someone maybe with more muscle mass gets them, or less muscle mass, or more body weight?
There are definite predisposing factors to getting an ACL. Again, the evidence is there to say that perhaps a higher sort of hip width, narrower knees might be part of it. There's definite evidence to say that if you get one on one knee, the chances of getting it on the other knee are very high. And certainly if you think about it, if you're a bigger guy or a bigger person and you're stopping and cutting and changing direction, of course that's going to put a lot more pressure through your knee.
See, when you say that, the first sport that comes to mind is like rugby, because I mean one of my best friends is a rugby player. Shout out to Zion, and he is the muscular size, the muscle mass on him, and the change of direction, the speed is phenomenal. It's almost freakish.
Absolutely.
Are those the people you kind of look over more and kind of wonder, right, I need to be careful with that type of athlete?
Kind of. At the same time, rugby isn't hugely known for its ACL numbers. Yes, they do change of direction, but they do a lot of sport running straight ahead. They're also incredibly strong.
Right.
And so their sport is a little more predictable than, say, football,
Yeah.
when they're following where the ball might go, or Aussie rules where the ball moves a lot faster and a lot bigger fields and so forth. Yeah.
And I mean, you obviously stay fit, and you you train quite a bit as well. I've heard about your exercise training. Yeah. Are you more, because of your profession, are you more aware of the things like the correctives and the preventive exercise you have to do?
I'm aware of them because of my profession, not for me personally. I don't play sports that are high risk for ACL. You know, I do CrossFit for all my sins. I do Pilates and I do tennis and running, and skiing is a higher one. But with skiing, it does tend to be the less experienced,
Right.
the higher rate of ACL injury because you get a ski court and so forth. So I don't tend to train specifically for the ACL.
What are the higher sports that do cause that? You mentioned skiing briefly.
Yeah, skiing, soccer.
Yeah.
Aussie rules,
Yeah.
and I know a lot about Aussie rules because I'm Australian and that's the sport I follow.
Yeah.
Netball, handball.
Okay.
They're the big sports.
Interesting. Well, we're going to take a quick break, but after that, I want to know how we prevent this, because those people are listening in now and tuning in, probably thinking, right, so how do we stay away from that? Stay tuned for more on the only place to be at 3, the halftime show on Pulse 95.
Oh, he loves the fire, then what a goal!
This is the halftime show with Omar Al Duri on Pulse 95.
Nice strike! Oh, better than nice! Wonderful! Let's get ready to rumble!
Yes, we are back and we are live on Pulse 95 Radio. Thank you for everyone who's tuned in. If you're wondering, what did I miss in the first segment? Don't worry, you can catch all the episodes on podcast, Apple, Spotify, SoundCloud, or if you prefer a visual, head over to the YouTube channel Pulse 95 Radio, and all of our episodes are there with our fantastic guests. We cover things like mental health, gut health, and how important the brain is on performance and recovery. Miffy, how you doing?
Very well, thank you.
Miffy, so already we've got quite a bit of traction on the Instagram Live. People are talking about the ACL and what it was. But more importantly, for those who haven't, and thankfully haven't suffered an ACL injury, how do we prevent it?
The first thing I'm going to say is just in the break there on your social media, Omar, you talked about preventions being seen as quite boring.
Yeah.
And I get that. But what people need to realise is that if you rupture your ACL and you want to get back to sport, you've got a 9 to 12 month period getting back to sport. So that might change people's opinions if they think about why I might want to prevent this happening.
Yeah.
If it's going to take you out of your beloved football or Aussie rules for 9 to 12 months, maybe you should get on to preventing it so it doesn't happen.
Where does that stigma come from? That whole prevention equals kind of boring.
I think my personal belief is that we still believe that we are all infallible. It's not going to happen to me. It happened to him, but it won't happen to me. I think it's as simple as that. We just don't consider the bad things to happen. Maybe that's a good thing because it means we're in a positive mindset. But at the same time, if you can do something about it, why wouldn't you?
Yeah, that has its pros and cons, and I think the younger we are, or the more fresh we are to sports or exercise or anything, we do kind of have that feeling, and then when it does eventually happen, it's like,
how did it? How did that happen? In terms of prevention of ACLs, there's a lot of research out there. There's a lot of money, particularly professional sports. The numbers are really high. So these guys who are getting paid millions a week and they're out suddenly for 9 to 12 months is unacceptable. So we're trying to reduce ACL injuries, ACL recovery times, and we're trying to increase the understanding of the ligament, the function of the ligament and the recovery of the ligament. So there's a lot of money going into the way we can prevent it. And there are sort of some institutions or organisations that have brought out, I've listed 5 rehab or prevention programs that are either aimed at general reduction in injuries or specifically for the ACL. And what they tend to be is like a 20 to 30 minute program. And the evidence says if it's done 2 to 3 times a week, some of them can reduce your injury risk by 40 to 50%. I mean, that's huge.
That's massive.
Huge.
Yeah. What kind of things are those then?
So you've got like the FIFA 11 Plus, which is probably the most well known, which of course comes out of FIFA. It's a general reduction in injury program, but its aim is to look at increasing the strength of the legs and the lower limb, increasing the speed, the control of acceleration, deceleration, reaction times, change of direction. So it's very football focused. You've also got out of Australia, I do believe that the Australian stuff is far superior. You've got from Football Australia the Perform Plus program, which is also soccer. We call football Aussie rules and soccer, but it's a soccer-based program, and it's considered kind of the revision of the FIFA 11 plus.
Right.
Then you've got one out of America, I think it's somewhere in California, called the program Prevent Injury and Enhance Performance. It's also coming up as one of the good ones. Again, it's a soccer-based program.
Okay.
But the two I kind of like the most personally are Netball Australia has one called the Knee Program, which is specifically for the ACL and looking at preventing ACL in terms of netball.
Yeah.
And then the AFL, which just recently, I'd say maybe 4 or 5 years ago, started a professional women's league.
Nice.
They've got Prep to Play, and it's based around women and the way women play and what women need to focus on. Because the other area we're seeing is with these Aussie rules girls that are playing, the number of ACLs is extremely high. I'm going to guess it's over 3 times as many as men.
Wow.
Yep.
Is that because they've just started to really come to the surface?
Yeah, I think so. I think, well, what they're saying is it's got a lot to do with things like menstrual cycles and where you're playing and when you're playing in your cycle, which can definitely affect your ligament strength. But the other thing they're tending to say is that because as kids, boys play football and run around and chase dogs and a lot more than girls are encouraged to do.
Or a lot earlier?
Yeah, that's what I mean. Boys, like kids, they're doing this stuff, whereas women girls aren't, and historically aren't doing this as early.
Yeah.
So neuromuscularly, like the connection between the brain and the muscles perhaps isn't as developed as it is for boys. So that's the other thing. Oh, and of course biomechanics. You know, we tend to have wider hips, narrower knees, all that sort of thing.
Yeah.
But these programs are really, really positive and should be done by, they're set up, they're all on the internet. They're set up for coaches and trainers to get involved and prevent their young kids from getting in trouble. They're grouped from ages and sports. There's no evidence yet on the crossover. So if you're a netballer and you're doing the AFL Prep to Play program, there's no evidence to say that's a good thing. But my guess is they're all working toward the same thing, which is to strengthen you and avoid knee injuries. So realistically, do whichever one. You're going to get benefits if you're doing it properly.
And how important is it to stay on top of things like technology and sportswear, and because nowadays it's whatever you see on the gram that kind of gets people's attention. But obviously with you invested so much time in your coaching and your learning in your education system. How much of that is down to the external factors?
So if we go back 10 to 15 years, you're talking about things like football boots, right?
Okay.
And blades when were blades in? Like 20 years ago, 15 years ago, something like that?
I'd probably say, around the 90s.
Yeah. Oh, really? That long ago? Okay.
Yeah.
So blades were like the coolest thing. And had we had Instagram, they would have been everyone's wearing blades. Ronaldo's got blades, righty. And then we tended to find that things like blades actually created more traction on the ground, which sounds like a great thing. But when your foot is stuck on the ground and you are trying to change direction, that's the exact kind of force that can lead to ACL. So ACL numbers rose, and we really were interested in that. We were interested in what you were playing on, what surface you were playing on, whether it was artificial turf, whether it was hard surface, grass, whether it was soft mud, that sort of thing. They're all really important, but at the end of the day, you've got to work on yourself to actually prevent this sort of stuff happening. You can't say to your team, "I'm not playing on this ground because it's actually a high risk of ACL." Well, of course you can; it's your choice, but it's not likely to happen. Whereas if you get yourself strong, if you practice changing direction, learning the mechanics of changing direction, learning the mechanics and the reaction times, the chances of you taking control of it are much higher.
That's interesting. Because I always hear different coaches, different practititioners saying, the barefoot versus the higher heel, sole, orthotics, not orthotics. What's your take on that? It's a tricky one, I know.
It is. I guess if I look at it properly, everyone is different and everyone's strengths are different. I think when minimal shoes and barefoot running came out, it was like, there's much less injury with these guys. And when you look properly into the studies with the people they were testing, these guys were college athletes. They were sort of, 18 to 24, really good technique, really fit. That doesn't translate to your 2-time-a-week runner, 5K at sort of 6.5 minute kilometres an hour. So I don't believe that minimal shoes and barefoot running is for everyone.
Correct.
If it's for you, fantastic, but it's not for everyone. And much the same, sorry, what else did you mention? You were talking about trainers and...
Orthotics?
Orthotics is a tough one. Technically, there is very little evidence to say orthotics work. But you see them on patients and they do work.
Yeah.
So I guess if we're talking orthotics, we really should have a podiatrist here.
Right.
I can hook you up with a podiatrist if necessary. But again, the idea of orthotics is to put your foot in a slightly better position than it is naturally, which should feed up. But then I look at it and I think, okay, so if you're running and you're getting foot pain, you're probably functioning decently, right? It's not like you're standing and you get foot pain. So why not work on those strengths first before you go putting something into the shoe?
Yeah.
I guess that's the way I look.
I like that.
Yeah.
Okay, coming up next, we're talking about what are the steps to making the comeback from an ACL injury. I'm spoiling you with this, I know, but thanks to Miffy, we can have all the answers on the only place to be at 3, the halftime show on Pulse 95.
Oh, he loves the fire, then what a goal!
This is the halftime show with Omar Al Duri on Pulse 95.
Nice strike! Oh, better than nice! Wonderful!
It sure is that time. It's the halftime show with Omar Al Duri. I'm your host, covering everything sport, international and local. What a privilege it is to have Miffy in the building today, talking to us about ACL and all about it. I'm saying from how to prevent it to what caused it, what are the steps to coming back, what it is. I mean, so much good stuff here. And we are talking to her on this segment about what are the steps to making the comeback from an ACL. So Miffy, let's just say now we've had the ACL and obviously the doctor then comes to you and shows you there's different grades.
Well, typically with ligaments there are different grades. There's grade 1, which is, I tend to explain it to patients along the lines of, if there are 100,000 fibres in your ligament, a grade 1 might be 10 to 50,000 fibres are broken. So you're going to get pain, but you're not going to get instability. The ligament is still strong. A grade 2 would probably be up to around 750,000, something like that, or 75,000, can't remember what number I said. And then a rupture, a grade 3, is a complete rupture, complete break of the ligament. With the ACL, there is a bit of controversy. There are a lot of people out there that believe the ACL can only completely rupture. And there is no grade 1 and grade 2 ACL, whereas you've got other people in science believing there's a grade 1 and a grade 2 ACL.
Okay.
The only way we can, you can do an MRI and hope it tells you, but the gold standard, the only way to perfectly tell is to go in and have surgery, have an arthroscopy.
Right.
But people aren't going to line up for that if they think, well, have I got a grade 2 or a grade 3? You're not going to just automatically going to have an arthroscopy.
Yeah.
So we tend to treat everyone on more a symptom or a sign basis, what can they do? So in terms of making a comeback, what we tend to see is more the rupture.
Right.
That's who we're dealing with.
Yeah.
Whether they're coming from the surgeon or whether they're coming because they've ruptured and they want to make a decision. So the big things are, you need to, in my opinion, you need to get opinions.
How many opinions?
It depends. I'd be asking the people at my sports club. There are going to be people that are there that have the similar lifestyle to you, because what we now know, which is pretty cool, is that the return to sport rate, the recovery times, the long-term outcomes, and the chance of further damage to the knee is relatively equal between whether you have surgery or whether you don't. So what you've got to then ask is, okay, my friend, he plays football, he's a dad of 3, he's doing really well, he didn't have the surgery. Do I therefore need the surgery? So you want to be speaking to your friends, your colleagues. I'd suggest at least 2 medical opinions.
Okay.
And I'd also suggest a physio opinion, because at the end of the day, not to float our own boat, but we are the people that know about rehab.
Yeah.
We're the ones that know the commitment it takes. We're the ones that know how long it'll take, and we're going to give you those honest, well, I would give you brutally honest opinions. Yeah.
But there's also something else. Now, sometimes when people do have the injury, obviously the shock and the factor that, you're not sure if it's serious or not serious, there's been advice sometimes to take a few days before you actually get an MRI or
100%,
a scan.
yeah.
Tell us why.
So first of all, there's going to be a lot of swelling. And swelling in an MRI can hide what's going on anyway.
Right.
The other big thing that we used to do is you used to hear about these guys, particularly in professional sport, they damage their knee on Sunday, their surgery on Monday. And the one thing that is tending to come up again in the research is that the earlier you have that ACL, or the closer to the time, the higher the risk of early onset arthritis.
Okay.
Now, why that is, I'm not sure they're 100% convinced on.
Yeah.
So what we are encouraging people to do personally is spend at least a month, 2 months getting that knee quiet. You know, reducing...
Tell us what that means, yeah.
Reduced inflammation, number one. Reduced heat. Return range of motion.
Right.
And be able to walk comfortably, climb stairs, descend stairs comfortably on that knee without pain.
Right.
And then you can make your decision.
See, again,
that's where rehab then begins, right?
Yeah.
That's just us settling the knee down. That's not us actually aiming to get you back to football or netball or skiing.
And can rehab sometimes start before the surgery if you're
100%.
waiting those...
We call it prehab.
Yes.
Yes.
Tell me about that.
Again, the recovery seems to... The recovery after having prehab before surgery shows a better recovery because you're already getting those muscles kicked in, so they're working. And what you've got to realize, if you choose to have a surgical management of the knee, your quads, your calf, your hamstring are going to shrink.
Yeah.
Right? That's part and parcel of having surgery. And then it's our job to help you build them up again. So what we can do in prehab is get you as strong as possible to reduce the difference when you lose those muscles again.
Love it.
Yeah.
Love it. Is there a duration where you kind of have to think, okay, it's time now to actually get back on your feet, or it's time now to move? Because I remember you said now all these things, all these factors, like from range of motion to being able to ascend and descend. Is there a time frame where you actually say, all right, you've served X amount of months now, it's time to maybe tackle the fear factor mentally and put yourself in the fire line again?
As in return to sport?
Yes.
Absolutely. Absolutely. But there's a huge number of steps before that.
Yeah.
You know, leading into that, it's not just about, say if you choose not to have a surgical actually, it doesn't matter whether you have surgery or not. You've got to get the range of motion back. Something I say regularly is we can get strength back in 6 months' time.
Yeah.
If we don't get range of motion back now, it's stuck. So the first thing is getting that range of motion back, particularly with ACLs, getting back the extension, the ability to lock out the knee.
Yeah.
Then you need to be bringing back in strength, control, balance. And you should be moving that your program with your physio. You've got to find a darn good physio.
Oof, I know one.
Yep, good. Who is she?
Miffy Edlund.
You've got to be moving and progressing that program forward on a very regular basis. And I'm not saying if someone has pain, you don't just automatically move it forward. But if someone is recovering well, if their progress is going well, if they're adapting to the new exercises really well, you have got to be continually increasing that program so that you are bringing in strength, control, power, speed, acceleration, deceleration, change of direction, reaction times, sport-specific drills. That's got to be a progress, and you've got to be partaking in it. If you're not willing to commit as a patient for that 9-month rehab, then you maybe need to think about what you want to do after you've recovered, because you know all injuries require a big component of exercise therapy. It's a guarantee. Every research paper says it. But ACL recovery is almost solely exercise-based, particularly after that first 3 months when you've got the range of motion back, you've got the function of the knee back. It's exercise rehab. Now, we can give you the information, but we can't do it for you.
Love that. Okay, we're going to take a quick break on that. Just hearing you say that, I'm sure has assured a lot of people mentally, which is what we're going to be diving into straight after the break. Stay tuned for more on the only place to be at 3, the halftime show on Pulse 95. See you in a bit, folks.
Oh, he lifts the fire, then what a goal!
This is the halftime show with Omar Al Duri on Pulse 95.
Nice strike! Oh, better than nice! Wonderful!
Let's get ready to rumble!
Yes, we are back and we are live on Pulse 95 Radio. Thank you very much for tuning in today and spending your hour with us here in the heart of Sharjah. And shout out to everyone from around the world who has sent in their questions to our wonderful Miffy Edlund, who's in the studio today. Question coming
Real
in.
life clap.
Yeah. Question coming in from Olivia, who's tuning in from the UK. Said, okay, slightly off topic, but do you both think Epsom salts aid recovery and muscles, or is it a myth?
It's a very topical question. The idea of Epsom salts is to draw fluid out of the body. So if you have had a difficult day on the field or a hard day on the field, you get in a bath of Epsom salts and it draws out the fluid. It's interesting we're talking about it because forever we've talked about RISA, rest, ice compression, elevation, referral, that sort of thing. And what we're now looking at is actually getting rid of icing. The swelling of an injury or the swelling post-training is actually your body's way of handling what's happened.
Right.
It's a natural, they call it a cascade, a natural cascade of recovery. So since all this has come out, which has only been the last couple of years, I haven't really thought about whether Epsom salts are a good idea or a bad idea.
Right.
In the past, when it was regarding, when we thought ice, yes, I really liked Epsom salts at the idea that they draw the fluid out of the body. Now I'm not actually 100% sure. I think I'd be more likely to say continue on so long as you know you don't have an injury.
Right.
If you have an injury, no, I probably now wouldn't encourage Epsom salts.
Wow, controversial.
I hadn't. This is the first time I've actually contemplated it. Maybe I'll change on the drive home.
Right. Right. I like that. Okay, so we all know that injury requires a lot of mental strength.
Yeah.
And with that mental strength, how much of physio or rehab is mental?
If I think we stick to talking specifically about ACL.
Yeah.
Huge.
Okay.
Humongous. When these girls and guys are going back to sport and they know that they were changing direction, which is a move they have done 1,000 times in training or in play, and their knee gave way, the idea of that happening again for the amateur athlete is very scary. It's the first thing they say. The number of amateurs I get in that say, "Oh, look, I think I'm just gonna stop. That's the end of my career." And I think it's a real shame, and it says a lot about physio because we in the past have looked at strength, and you must have strength, and you must have your hamstrings kicking in, and you must have balance, and you must be able to accelerate, decelerate. But what they're coming out with now, and it's incredible stuff, is these degrees of your knee moment and your hip moment and your foot moment during change of direction particularly.
Right.
And then the next step is teaching people to work within those parameters. So I think the more we can do that, the more we can settle down that fear of going back, because you're saying to them, this is why it happened in the first place. Now what we're doing, see how we're working on that so it doesn't happen in the future. But that doesn't happen for everyone. This is if you're actually paying attention, if you're educating yourself as a physio, you're then going to pass it on to your patients. Sadly, not every physio does that.
Right.
And then on top of that, you've got, more likely your professional athletes who've done their ACL. Bam, they've done their ACL again. Bam, they've done their other ACL.
Yeah.
And then the fear really kicks in, and you've got to be mindful that it might be worth bringing in a psychologist. Sports psychology is really important these days, and it's really popular in a good way.
Yeah.
To get over that fear, and working as a physio, working with it, is essential. Absolutely essential.
Very interesting. Masood is asking, how about Reset? Let us know about her opinion.
Reset. Well, first of all, I went to the opening, or I went to the launch,
yes,
which was very exciting. So I read Reset. Goodness, 2 years ago?
Yeah, that's right. I remember 2019.
2 years ago.
Yep.
And I guess I'm kind of lucky. I'm very practical and very straightforward. So I haven't had a lot of struggles with my mental health.
Right.
And I haven't had a lot of struggles or need to reset per se. But it certainly sits on my bedside table.
Okay.
Ready for the day that I'm struggling. And it will happen. I think it happens to everyone at some point.
Yeah. Fantastic. Love that answer.
I just want to go back to one thing about mental health and so forth. The other thing we're doing in the medical world now is we're working really hard on language. We've always talked about, your bad knee. This is the worst I've ever seen. The doctor told me it's the worst break I've ever seen. What we know now is the importance of the language that we as professionals use with patients is incredible. And every day I hear myself saying something that I curse, and I'm like, I didn't mean to say it, and I have to backtrack because you see me as a professional.
Yes.
Even though I'm not always acting professionally. But you see me as a professional, and the weight of my words is quite heavy.
Yes.
And that's the way the medical fraternity is now going, is think about what you're saying, think about it and put it in a positive light.
Yeah.
So that's also really important for the mental side of recovery.
Love that. Thank you so much. We have reached full time on the halftime show. That's the second one and you smashed it. Well done.
My pleasure.
She was fantastic. And if you liked the episode, make sure to share, like, and subscribe to Pulse 95 Radio on the YouTube channel. Or if you prefer a podcast, Apple, Spotify, SoundCloud. Miffy, you were fantastic as always.
I'll also give you the names of those prevention programs.
Yes,
that
please.
you can put on your social media and stuff, because they are super important.
Absolutely. I'm going to share that on my page as well. And yeah, make sure you check that out. And thank you very much for tuning in. Miffy, you were fantastic.
Thank you very much.
Okay, guys, I will see you every Monday, Wednesday, Saturday, 3 to 4 UAE time, same place, on the only place to be at 3, the halftime show on Pulse 95.
If you liked this episode of The Halftime Show, drop a like and subscribe.
95.
Be sure to follow us on Instagram for all our daily updates and top stories.